What if we had the ability to conquer a cancer? Cervical cancer is almost completely preventable. However, in 2023 in the United States, roughly 14,000 women will be diagnosed with cervical cancer, and over 4,000 women will die of the disease. The state of Alabama has some of the highest rates of cervical cancer in the country. But what if we could change that?
How much cervical cancer is there? Really, there's more cervical cancer in our state than in most states in the nation.
When it comes to cancers, this is the one that we've got figured out from A to Z.
To lose anybody to cervical cancer is terrible because it is so preventable and so treatable.
Until we get to a population level of benefit with the vaccine, which is going to take decades to get to, we have a segment of women in this country who are still very much at risk of getting cervical cancer.
The mortality today in the US and Alabama is now no different than 1999. We haven't made a dent.
I think people just, it's kind of just out of the back of their mind. They don't understand it until it's too late.
Human papillomavirus is the main cause of cervical cancer. 80% of all people will be infected with HPV at some point in their lives. The majority of HPV infections will clear up on their own, but some can lead to precancer, which then progresses to invasive cervical cancer. HPV is completely preventable through vaccination, which can be given as early as 9 years old up to 26 years of age.
So Alabama, we're third in the US in mortality of cervical cancer. Once we found, not we, people much smarter than me, found that HPV is the main cause of cervical cancer. That gave us two huge options in terms of prevention, with the vaccination and screening. The problem is we can have the best technologies, but if it's not taken by the population most affected by the disease, we have a challenge. 40% of women with an abnormal screening do not come for follow-up. So that's a problem, and that's what accounts for mortality. Women are women no matter what culture. They are the caretakers. They're going to think about everybody else. Their own health is not a priority.
You know, going to the gynecologist is not something that anybody goes, oh, I think I want to take a day off from work and go do this. I was so busy running around taking care of my husband and my kids and everybody else in my life that I wasn't really taking care of me. I swore up and down if there was something wrong with me, I would know. So, you know, when you come into the doctor, of course, they ask you, when was your last period? I was 49 at the time, so I'm just like, well, they're kind of iffy, so I couldn't really tell you when my last one was. They said, well, when was your last pap smear? I said, about 1992. And the look on the doctor's face was just like, so she said, well, we probably need to get that taken care of. And of course, the pap smear came back abnormal. So I came in and had a biopsy, and then it was cancerous. And I was just like, okay. And he said, my office will call you to schedule. Okay. Well, you know, that next month, it was my birthday. And then the next month, it was my wedding anniversary and my mother's birthday. And then we went on vacation. I was diagnosed in July, and then before I knew it, it was November. There's a lot of guilt in thinking, you know, I did this to myself. I should have gone to the doctor. I should have done all the things I was supposed to. I didn't tell anybody anything until November. So I messaged the doctor and said, you know, I haven't scheduled this yet. The doctor called me the next morning and said, can you come in Monday? Which should have been a clue that, oh, you need to do this right now. I still put it off for another 2 weeks. By that time, it had spread, so we went to the next step, which was surgery. And if you go in the hospital, people tend to notice. Now I've got to tell my husband. He was devastated. I was really lucky, and it went really well. They got everything. Now I'm still under surveillance. I still go see the doctor right over there in the women's and infants, once a year and let them check, make sure everything is still good.
In our division, we see roughly about maybe 75 to 80 cases per year, and those are women who have bona fide, what we call invasive cervical cancer. But beyond that, we see hundreds of cases of women that have what we call severe precancer. These are women that I would argue that are at significant risk for developing cervical cancer during their lifetime. And they don't come in for screening because there may be cultural barriers, there are transportation barriers, or they simply can't afford screening. Two is that they have an abnormal test and they can't get in because they can't afford the diagnostic tests, or they have transportation issues, or they have insurance issues. And then after that, sometimes the physician or the provider makes the wrong choice, makes the wrong decision, and they say that instead of treating the patient, that the patient gets something else, or they can't come in and there's a lack of follow-up. And then lastly, they can't afford the treatment and they don't come in for years, and then bam, they develop cervical cancer. So there's multiple touch points. I want people to understand it's screening plus diagnosis and treatment. And it's the diagnosis treatment arm that I think that we haven't given it enough attention to, that I think that has fallen short for a lot of women in this country.
2004, my life changed. I got a call at work stating that my biopsy had came back and they saw some cancerous. And at that time, I was 30 years old and I was in the process of trying to get pregnant. For the last couple of years, I was having to go and do a Pap test twice a year. My doctor, he was just telling me that they were coming back abnormal. I was experiencing bad pelvic pains. Other times, I have had embarrassing moments of going to work and walking, and I was discharging blood clots, so it got to the point that I was wearing protection every day to keep from the embarrassment, because I never knew when something would appear. Got a call at the office with one of the nurses, and she was just saying he needs to speak to me and my husband like ASAP. I went and met with my doctor, and he told me he had to immediately do a hysterectomy. The healing process was terrible. I was off work probably almost 2 months. I couldn't take narcotics for some reason because they made me vomit. I had, I think, like 8 incisions on my bikini line. My stomach hurt and burned a lot. And it was some nights that my husband had to hold me up to actually use the bathroom. At that time, I didn't know the questions to ask. They said no to childbearing, and that's something that I wanted. I wasn't educated on cervical cancer, but now I look at the situation different. I hope any female, before they have a hysterectomy, if you have any question, ask. No question is a stupid question when it comes to your body and your health.
Within Alabama, there are more African American women and Latinos that get cervical cancer, and then there's more that die from cervical cancer. There's a lot of barriers. Alabama is very rural. It's difficult because of the distance to the clinics. It's difficult because we don't have that many physicians in the rural areas. There is a stigma when it comes to cervical cancer. It's not something that's easily spoken about. When women are told they have an abnormal Pap smear, they're a little reticent because they don't really understand the significance of or the danger of cervical cancer.
A lot of it is just being scared. What if something is wrong? Do I want to know?
I can't tell you the number of times that I've cared for women who have been screened. They've been religious with their screening, but because of financial barriers, they can't get evaluated and they can't be treated. Well, I think that's a shame. I mean, I think that's a travesty.
We have the Alabama Breast and Cervical Cancer Screening Program here that provides screening, and they can get the vaccination for free. But a lot of people do not know about those services.
In remote areas, you'll find that women may not have a gynecologist in their community. The healthcare provider may be a nurse, may be a primary care physician. They may only be servicing clinics in those communities once or twice a month. If you don't get the timing right, if you don't really work to make it a priority in your own sort of, in your personal priority for yourself, you can easily miss out on healthcare access in rural communities.
People in the big city, I know Birmingham is not New York City, but it's a big city for Alabama, underestimate how overwhelming it is for somebody rural to drive to Birmingham. It's overwhelming. Cervical cancer is a disease of poverty, so if you look at the distribution of cervical cancer in Alabama, some counties experience higher burden of disease.
We are the 6th poorest state in the U.S. So with that being said, when you tell a woman that she needs to go 2 hours up the road for treatment, and she's thinking, well, I barely have enough money, for my children or my household expenses, how am I supposed to juggle this? And it's really hard for women because we know we're going to take care of our family before we take care of ourselves. So women were just not getting their procedures done.
People need to understand that the capacity to eliminate and protect against this virus is there, and it's not going to hurt them, and that it is very effective, and it has been effective for many, many years. So education, I think, is the primary thing that's holding us back here in Alabama.
After COVID-19, after the coronavirus, vaccines and the word vaccine has really kind of become taboo with certain groups. There's a mistrust with vaccines. I've heard people talk about not wanting to go to the doctor because they're scared. They don't want to know. They don't want to go get screened in case something is wrong. They don't have high-speed internet. And so if they don't have that high-speed internet, they may not be receiving a lot of the media forums and a lot of the information that may be being pushed out in other places. Transportation is an issue. It's a multifaceted problem that needs to be attacked from a lot of different angles.
One of these angles is screening women for cervical cancer. If an abnormality is detected through a Pap or HPV test, a colposcopy can be performed to closely examine the cervix for precancers and early signs of cervical cancer. It can then be treated and cured before it leads to invasive cervical cancer. This procedure is not painful.
At Alabama Department of Public Health, one of our visions for Alabama is, healthy people, healthy community, healthy state. So we really had to take a look and see what is going on. Why are our rates so high? And our vision is for complete health. So that's actually how we got started with the colposcopy project. A woman needs a colposcopy after her Pap smear if it comes back abnormal. And I think that really scares women, but it's not a procedure that should hurt. This is just basically a telephone. And of course it has this in-depth zoom lens and this high-powered light that will come on and shine into the vagina so you can see the cervix really good. We take a lot of pictures of their cervix, it uploads it to a portal, and then we download it into the patient's chart. And then if we see anything, on the cervix, we can take just a small piece of tissue and send that for pathology. Sometimes we don't want to know, but it's better to find out early so it can be treated. It can be completely cured. You don't ever have to have cervical cancer.
Part of my role at the Cancer Division, of course, is to take the federal, the state, and even the local funds that we have and put them to work to reduce the burden of all cancers in Alabama. One of the main parts of our program, or even the heart of our program, is the Alabama Breast and Cervical Cancer Early Detection Program. Women who may have been eligible for a program to get a Pap smear or HPV testing and received an abnormal result and don't have a way to get further help, we'll find them and we'll step in to make sure the cervical cancer is treated.
So we partnered with Alabama Breast and Cervical Cancer Detection Program. We had 6 nurse practitioners to get credentialed as colposcopists, so we had like a little small army, and we started going. We took our equipment and we went from north and south and east and west, and we started doing colposcopies. I think since 2019 we've done like 1,100 colposcopies. Now, if there is a diagnosis or they need further diagnostic care, we also have a program to pay for that. I have a colleague that she and I work together. We call tag team. Wherever we go, we typically go together.
It's really beneficial for my patients, especially I identify with them being Hispanic myself. I used to be in their shoes. When I came to the state 33 years ago, I knew very little English, so I know how it feels to go in a place where you are not able to understand each other. It's a wall in between, because you try to communicate with them, they're not giving you the information that you want in a way that you understand. Especially talking about cervical cancer, you have a diagnosis, you don't understand exactly how serious it is, you can have severe consequences. When you explain to them in the same language, in a way that they understand, they will be more willing to come back and do the next step of care. So I think it's very beneficial for me to be present, and of course it's very rewarding for me to be able to help them.
Since we've started taking the procedures to them, we are seeing women that has been needing a colposcopy for years, but they just never did it. So I think it's just been a great program for the women in the state of Alabama.
Together for Health is a nonprofit that works on cervical cancer advocacy. Historically, Together for Health was really created to build consensus around HPV and cervical cancer prevention outside of the U.S. But because I live and work in Alabama, and Alabama has among the highest rates in the country, I say to people I sometimes felt like an imposter going to bed at night, knowing that I was working so much and so hard for women all around the world, but ignoring sort of what was happening in my own backyard. I decided to reach out to colleagues at the University of Alabama at Birmingham. Isabel has always been, well, someone I've always appreciated her research and looked up to her. And I frankly didn't think that she would take my phone call. I figured she would tell me she was too busy. But we really hit it off, the two of us.
The planets just aligned. Heather White from Together for Health had the same dream, the same thought. We have a problem right here in Alabama. We need to do something. I work globally, but I'm based in Alabama. I was like, based in Alabama, we can do this.
Within just a few weeks' time, we had sort of crafted this idea on paper of could we create Operation Wipeout in Alabama to activate local communities, spread the word about this disease and how to access resources and services here in the state, and to eventually put together a plan for elimination for the entire state of Alabama.
Where do we start? You start small. It's like a recipe. Let's see if it works first, and then we expand. And so Chambers County has the highest incidence of cervical cancer.
When we first started to work in Chambers County, neither our UAB colleagues nor myself, we'd never been there. We didn't have any contacts. We were really going in blind, so to speak. Isabel herself worked through Birmingham's Rotary Club to connect with Rotary down in Chambers County.
Rotary is all over the world. You call Rotarian in Australia or Chambers County, they will open doors for you. And we call them, they identify a champion in their club, a retired dentist, and we started.
Rotary is a service organization. Our motto is service above self. We had some folks from our Birmingham Rotary Club and UAB Comprehensive Cancer Center came down and presented a program on cervical cancer and the impact it was having on the state of Alabama and primarily on Chambers County, where we live. The Birmingham Club asked us if we would like to partner with them, and that's where the great adventure began. When we first started, met Heather and Isabel and the folks from the Birmingham Rotary Club. We start putting together plans. Well, next thing you know, we've got involved with Auburn University School of Nursing. Then we start talking to the Alabama Department of Public Health, the Chambers County Department of Public Health. We were going to do a vaccination component. How are we going to do that? Well, we've got kids. Wait a minute, now where are the kids at? Oh, they're in the schools. So let's go talk to the school system. So we talked to our superintendent.
It was alarming for us to know that the Chambers County numbers were as high as they were. And then to learn that Alabama leads the nation and that Chambers County leads the state really sent up red flags to us. How could we partner and what could the school system do to help educate and to help start to get information out about the vaccine?
All right, say it with me. Preventive medicine is better than reactive medicine. Do y'all know what that means? Okay, so we're gonna start with preventive medicine. And y'all can start making great decisions about your health right now. Chambers County has the highest rate of cervical cancer in Alabama. All right, y'all?
And when educating the parents, we need to send things out to them in flyer form. We need to send things out to them on our social media platform, provide them with the information and allow them to make the best decision that they think that they need to make for themselves and their kids.
So she's gonna, when she gets your form, she's gonna keep the white form. You're gonna take your purple one home.
So right now we have 5 different schools that have participated in the program this year. And what we find is that over time, as parents start to understand the information, they see their friends and they talk, and then I think that those numbers will increase as we move forward. But also, those parents are in the time frame to where if they had not received the vaccine, that they need to be being screened. And I think that that's very important, that we could reach two different groups through that education process.
If you get the HPV vaccine at the early ages, you can basically protect your child from this virus potentially causing a cancer for the rest of their lives. They can be happy and healthy and not have to worry about HPV. There's been lots of folks that have tossed in their hat that have come to the aid of the Operation Wipeout because there is a secret sauce. The secret sauce is relationship. Heather, I get tickled at her when she comes down and she says, everywhere we turn, I cross the county line and everybody knows who you are. They tell me a story about you. I said, well, that's because I've been involved in their lives for 40-something years. I've been involved with Little League, Girl Scouts, politics. If you have relationships within your community, if you care for people, they're going to want to jump in and help you. We need to keep putting the word out there. Their education will be improved and they'll be talking among themselves and people will be saying, did you know about this HPV vaccine? Oh yeah, my child got that back last year in 5th grade. And so it just builds upon itself. And so our partnership here in Chambers County has just been phenomenal.
Well, one of the things that we were able to do this past year with the Alabama Department of Public Health is the Alabama Breast and Cervical Cancer Early Detection Program brought a number of healthcare providers from across the state to sit together for 2 days to talk about what are these barriers, what are opportunities, how might we intervene to be able to improve care, to be able to bring better care closer to women, etc.
With that summit, we were able to bring people together, hopefully inspire them to go home and be renewed in commitment to cervical cancer.
We decided to really use that as an opportunity to build a plan for elimination in other counties across the state.
Good morning. I'm excited to introduce a statewide effort to eliminate cervical cancer in Alabama. Yes, eliminate it. Operation Wipe Out Cervical Cancer in Alabama is the name of our effort. And today, we launch an action plan to do just that.
Having successfully made an impact in Chambers County, Operation Wipeout could now expand statewide. Together for Health, University of Alabama at Birmingham, Department of Public Health, Rotary, Auburn University, Chambers County School District, and many other organizations, now united under Operation Wipeout, turn their sights towards the target of eliminating cervical cancer in the state of Alabama.
There's 3 steps to this. There's prevention, and then there's the screening, and then there's follow-up, making sure the appropriate testing or treatment happens. And in each of those areas, we're striving to work through those barriers and see if we can't make a difference.
And much to our surprise, everybody that we've reached out to, we've engaged, we've told them about this issue and really the magnitude of the issue in their area have stepped up and said, what can we do? How do we get the word out? How can we continue to build this movement?
And then other partners, healthcare services, a federally qualified clinic said, what can we do? People start coming without any money. They start coming, it's like, okay, I can do this. I can do more screenings. I can help with screenings. Auburn University came on board. There is a Circle of Life, a nonprofit there. So people came to us to say, how can I help? That's, I think, is the most rewarding experience that I have had in my entire career. I had polio when I was 8 months old in Brazil, and my mom would spend her life. She would take me door to door, literally, with the shorts to really show the disability and say, you don't want this to happen to your child. But she did it in a way that was very proud of it and made me feel important. Who would not vaccinate their child when they saw a mother with a disabled child with her with the disease? I mean, how wouldn't you? I think polio was people like my mother, and was when Rotary Club jumped in and mobilized the Rotary Clubs in the world. Cervical cancer is exactly the same thing. We have the vaccine and we have the screening. It's in the hands of civil society to really mobilize to get these tools out.
We were looking to hire someone to really dig in there and become part of the community and figure out how to get our word out. Linda was our first interview, and we knew immediately that she had a service-oriented heart and that she was committed to reaching women. So we hired her. She's been here not very long, but she's already made a huge impact.
My name is Ms. Hayes. I work for the Department of Public Health with the Breast and Cervical Cancer Early Detection Program. And I just want to stop by to give you some flyers, tell you our information that we provide free mammogram and pap. I'm excited. I love what I'm doing. I know it's a purpose for everything that I went through. But right now, I'm more focusing on the ladies that can get screened and not have to go through what I went through. Thank you so much. Thank you. Yes, ma'am. Thank you. And I just thank God for this position. I know this is the right time and the right place, and I know I'm gonna make a difference. Whatever I can do, I'm willing to help.
So now as a patient service coordinator, what I do is I fast track people with cancer. I get you in as fast as I can and get all your tests done and put all the information in front of the doctor so they can determine what kind of treatment that you need. It is a hard job, it's an emotional job, but it's the most rewarding work. We have counselors, transportation. If you're from out of town, there's lodging, there's grants, there's support groups. There's even a service where if you're in chemo, they will come out and clean your house. To be able to help people with that is just amazing. I really think it's made a difference.
In late 2020, the WHO published for the first time their plan for eliminating cervical cancer as a global public health problem. They could tell that if we could reach the thresholds of vaccinating 90% of all girls by the age of 15, by screening 70% of all women, ideally at ages 35 and 45, and treating all cervical abnormalities, 90% of those, then we could essentially eliminate cervical cancer, which is phenomenal. I mean, it's really so exciting to me that we've got the elimination of a cancer on the table. And if anything, it's what gets me out of bed every day, because I think there's a lot of ambitious goals to go for in this life, but to say goodbye to a cancer, who wouldn't get excited for that? There's a long way to go, of course, but to be able to have a roadmap in front of us and to look to colleagues around the world who are making bold, ambitious steps every day towards that future is really what I get very excited about. This is our opportunity to really chip away, and so it's our duty. It's in some ways a privilege to be able to fight for women around the world, and particularly in Alabama.
I think it's very possible, especially if we work together. If we continue to build our partnerships and pull those resources, I have no doubt we can eliminate it.
I mean, I think that there'll be a generation of women, it'll be unfathomable to them that there was a previous generation of women that got a PAP every single year. So yes, I do think it's achievable. If we screened properly, diagnosed properly, and treated properly, then you can argue in many ways that the vaccine would just be sort of the icing on the cake.
And I think now toward the end of my career, what I see is really people coming together. I mean, if we can do it in Alabama, when we're ranked 3rd in mortality and incidence, I am sure we can do in other states. But we are not there yet. We are starting this journey. If I can see the end of 2 diseases in my lifetime, I mean, my mom would be so happy. I don't see why not. Not only other states, other countries. We need to have the will to do it. But I think I think it's doable. Maybe that will be my retirement project. So.
You might be wondering, what can I do to help wipe out cervical cancer? All of us can support getting children vaccinated against HPV. Children with an HPV vaccination will be protected against cervical cancer, as well as other HPV-related cancers. We can also support all women in getting screened for HPV and cervical cancer, and then support them in getting treatment if and when it's needed. Together, we can ensure that this cancer will be conquered. We can all play a role in cervical cancer elimination in Alabama. For more information, please contact Wipeout Partners.